We're recording. All right, this is Barry McDonnell. I'm with Cliff Reed. Cliff is the EMS Chief. He has been with the department for the last 15 years and is an all-around great guy. Thank you, Chief Free, for joining us today. And first, I just want to thank you, and I want to thank all of our first responders for following just the strict precautions and the guidelines. The fact that we've had 0 cases on the team is a testament, I think, to how serious and professional all of our first responders have taken it. And again, I just want to thank you for what you do and all our first responders again. It's I truly appreciate it. There's a lot of aspects of the job which I think I would enjoy, but the big part I know is that you deal with a lot of not so great situations and issues, and there's a lot that you have to carry mentally, you know, in dealing with those situations that we don't have to. And I'm very grateful for everything that you and all our first responders manage and deal with. So thank you. So I guess the first question, can you tell us a little about the EMS division of the fire department and the services which you provide?
Yeah, we're a department of over 50 firefighters and paramedics, and we provide medical emergency first response to the cities of Camas and Washougal. We also provide the ambulance service for the cities of Camas and Washougal, and also East County Fire and Rescue, which is about a 70 square mile swath of unincorporated land just north of the 2 cities.
And how, I don't know if you can hear that airplane, sorry, flying over me there. How is the department coping with the COVID-19 epidemic?
Well, make no mistake, this is a scary time, and it's particularly scary for our personnel, many of which have small children at home, pregnant wives, newborn babies. They have grandparents living with them. And these are all, as you know, high-risk demographic groups. But as a department, we have a good and solid plan. We've built in protection for our providers and the patients. Our crews are solid. They're dedicated to serving the community. They're compassionate. They understand that no one chose to get the coronavirus, and it's their role in the community to assist the ill and the injured, and they do so willingly. And I'm extremely proud to be associated with this very committed group of individuals.
I could not agree more, Cliff, and I too am also very proud. I think they represent the city very well. And when it comes to the protection and when it comes to the exposure that's out there, I know that your teams have been exposed in transporting different patients. What have you done as an agency to protect our personnel from the exposure of becoming ill?
Well, we understand the risk to our providers, but we also understand the risk that our providers present to the public in terms of acting as a vector and transferring the virus from one patient to another. And our goal is, and has always been, to keep our providers healthy and to limit their exposure. They have the proper PPE or personal protection equipment. We've built in time to decontaminate our rigs and equipment between calls, to shower, to change our clothes, change our uniforms. We restricted our stations to on-duty personnel only, no friends or family, no outsiders. We have temperature screens to ensure that employees are healthy when they arrive to work. They repeat this mid-shift and again before they go home. This ensures that they have remained healthy for the duration of their shift. And we regularly decontaminate the stations. And really, it's all about diligence by our personnel in terms of keeping our stuff clean and decontaminated and be ready for the next call, so that we don't carry the virus or just any infectious disease from one call to the next.
So have these precautions in any way changed or limited your responses to any calls?
Yes and no. We still respond to all calls, but our look is a little different. For those who've used us in the past, how we arrive is a bit different, and I think the citizens need to be prepared for that. We've instituted a canary protocol, which means that that we recognize that everyone we come across, everyone that we're called to, is a potential infectious patient. And so we send a single person in with full PPE, and this is going to be goggles, mask, gown, gloves, to initially assess the person and make sure that they don't have signs and symptoms of flu-like illness, or something that can be at risk to us or to hospital staff or to other people that we come into contact with along the way. And then that initial person notifies the rest of the crew of the level of personal protection that they need. And then we are really making an attempt to only bring the number of people onto scene that we absolutely need to extricate and to care for the patient. There's a couple of things when you call 911 that I think you need to be prepared for. And one is that the dispatch, the 911 receptionists are going to ask you about exposure to COVID-19 positive people, either in your home or in your workplace or in your community. And that allows us to make sure that we're properly prepared to keep us safe. They're also going to ask that you try to, if at all possible, come to the front door. And this is so that we, if possible, can have less penetration into your home, into the environment that you've been living if you are especially sick with flu-like symptoms. And this keeps us safe. It also keeps hospital staff safe, because we need to keep our EMS providers and our healthcare workers healthy. So I want the public to know that it's not going to take a great deal of time, but there are going to be some additional questions asked them when they call 911, but these are for good purpose and very important. So far, it has worked exceptionally well. We have had, within our agency, we've had absolutely no illness that's been related to the coronavirus since the inception of this back at the beginning of March, which is amazing. I think a lot of that is a testament to kind of processes that we put into place early, but a lot of that has to do with the unbelievable social compliance with the restrictions that have been put on our community. And I think that they have responded remarkably. And together we've been able to, limit the spread and keep this from becoming too acute and overwhelm our local services.
I agree with that wholeheartedly as well, Cliff. I guess, is there anything else that you would like to share with the community, or anything else you'd like to end it on?
As I said, this is a scary time. But we've been navigating this COVID landscape since the beginning of March, and we've protected our employees. We have transported many, many sick patients, and we've kept our providers safe while doing so. I think the community response to social restrictions has been phenomenal, which is important, because we're all in this together. As a community, be safe, make good decisions, take care of yourselves, take care of others, and we will get through this. We will survive the coronavirus. Camas-Washougal, we got this.
Very well said, Cliff. And thank you for everything you and all our first responders are doing. I'm impressed every day, and I appreciate everything that everyone does. Thank you.
Thank you, Barry.